And it is now my pleasure to introduce Lynn Mathre. She's the president of Patients Out of Time. She's also on the planning committee of this. She's a registered nurse. She's an addiction specialist. And along with Melanie Dreyer, I think she's probably the most known nurse in the world related to the subject of therapeutic cannabis. My wife, Lynn Mathre.
Good morning. We can leave that picture up. It fits. I think a lot of people, all they think of when they think of cannabis, I say the people, healthcare professionals who haven't been to conferences like this, they don't know what that picture is. They just know the leaf, and they think that's what medical marijuana is all about. I change my topic month to month as it comes to this conference, depending on who's going to speak and what they're going to talk about. And as some of the speakers were talking yesterday, I was noticing that we've got different audiences here. There are some people who know a lot about cannabis, and thankfully there are a lot who came here to learn a lot about cannabis. And I think that is the challenge we've got, is unlearning the lies. That's why it's been so difficult to try to make any moves anywhere. Even having the pictures up on the walls outside, up on the glass outside, was to an extent a threat to some. They thought it looked too much like there was a promotion of marijuana going on here. And I said, if someone would just read it, it's history, it's just information. We're trying to put out information. But that was something that was a challenge to people who've heard the lies too many times. So what I wanted to do is just give a little bit for those who don't know, who Patients Out of Time, who we represent, how we came about, and the handouts I left in here, which go back to the first day, they're a little out of order. I'll refer to them a little bit because it's just references that I think people can use quickly and easily to guide others to find some information. But a lot of this started with Bob Randall. He was mentioned yesterday and accordingly got the standing ovation. Bob Randall was the first modern-day legal medical marijuana patient using it for glaucoma. But Bob didn't just take the medicine and sit down quietly and enjoy it. He started the Alliance for Cannabis Therapeutics and worked diligently, he and his wife, Alice O'Leary, diligently, daily, for decades in making sure other people got that medicine. They made protocols for patients because, the FDA required a large amount of information to be submitted to get access to the investigational new drug program that would allow them the cannabis that was grown by the government in Mississippi. They had to work through the DEA. It was just a lot of work to get this medicine. And so they made the paperwork all handy. So for a glaucoma patient, the physician just needed to fill in the blanks about that patient. Or maybe for a multiple sclerosis patient, it was fill in the blanks. For AIDS, for the common things, they made this much more easy for them. I found out about Bob in the early 80s when I was working in Washington. And at Washington, at a small island hospital, but a patient from the University of Washington who was undergoing protocols for the now Marinol came to the hospital, and our director of nursing just about went crazy. I was the charge nurse on the unit, and she came up and said, "Mary Lynn, someone's got marijuana. What are we going to do? He's supposed to come to the hospital." I said, "Well, that's okay. If you feel better, we'll lock it up with the narcotics." But it was an elderly man that came in, and he came in and he had his two grown children who were there to tell me about how this Marinol, they thought, saved their father's life. He was wasting away. And that hit me. But about that time, again, serendipity comes along. Somehow, at Whidbey Island Hospital in Puget Sound, Washington, I got this flyer about the Alliance for Cannabis Therapeutics from Bob Randall, telling us about his access to cannabis and the fight to help other patients get it. And that was just kind of something that's stewed with me for a while. After Whidbey Island, Al was transferred to Ohio, and I went to graduate school at Case Western, and I ended up doing my thesis on marijuana disclosure to healthcare professionals. At that time, I just wanted to know, are we asking people about it? It's the most used illicit drug. Do healthcare professionals care? We should care about what they're using so that we can find out if it's hurting them or helping them and give them good advice. So how do you find that out? How do you ask people about marijuana? Well, I'll go to NORML, the National Organization for the Reform of Marijuana Laws. I figured most of their members use marijuana, so hopefully we can get some help there. They agreed to send out my survey, so we sent it out, and I ended up, I think for the thesis, it was maybe 700 responses. In total, I got about 800 responses of people using marijuana from age 18 to, it was, to 80 or so. Most were never asked by their healthcare professional if they used cannabis. But if they were asked, more than 50% did say that they would admit to use because it's a healthcare professional and they should know, which is what I was happy to hear, and that's what I thought. One of the disappointments about that study was I said, would you be more willing to tell a physician or a nurse? And they were more willing to tell a physician. And my disappointment was because it was of the confidentiality. They were well aware of the confidentiality between a physician and a nurse, a physician and a patient, but some of them said, nurses talk too much. Or I can't tell the difference between my nurse and some of them were thinking doctor's office, the receptionist. And for my thought, I was just thinking the longer relationship with a nurse, but I was looking from a hospital point of view, and some of these patients were talking from their long-term physician, so it's good to know that they would talk to a physician. But in the end, I asked, there were a lot of things that came out of the survey, but the last question was, what are your health concerns about cannabis? Is it, and I gave them a checkoff list. I worry about my heart, I worry about my lungs, I worry about what it'll do to my brain. If I'm pregnant, I worry about the fetus, and other. And I actually I don't have any concerns even though I'm a moderate user, I don't have any concerns even though I'm a heavy user. And then I asked other. That other was filled in a lot. I use it for migraines. I'm a spinal cord injured patient. I use it for spasticity. I've got glaucoma. And there it was in front of me. There's something going on besides, and there was this Bob Randall, and now is this. And so we started going from there. I got a little bit more active with NORML. By 1990, at the NORML conference, we got the first 5 legal patients, and that was Elvie Masica, Irv Rosenfeld, George McMahon, who couldn't make it here, Corinne Millette, and it wasn't Barbara. Help me out, guys. And Bob Randall, number 1. Number 1 man. Barbara Douglas came later. She's a patient with multiple sclerosis. Many of them came thanks to this. That was picked up by C-SPAN. We were very lucky. So across the United States, people saw these 5 patients talking about cannabis. And the phone went off. It just was ringing off the hook at NORML, people wanting to know what was going on. Bob got many, many calls. The protocol started coming in. And by 92, they shut down the only access that patients had to cannabis. There were too many applications coming in. Most of them were AIDS patients. And actually, when they closed the program, one of them said that there was a concern that there might be rampant sex among the gay population if they got this cannabis. But they shut the program down. When they shut that program down, there were 15 patients getting their cannabis. There were 30-some who were approved to get their medicine, but the government said, sorry, you're never going to get a supply from us. And of the other hundreds of applications waiting, we're not going to look at them. They closed that program. By 1995, there were 8 patients left. And that's when we came about in terms of patients out of time. It was with some of the legal patients, other healthcare professionals, and just saying, this, probably the biggest lie we've got out here, or the biggest excuse healthcare professionals use, everyone uses, is we need more research. And that's what Patients Out of Time is all about. We don't need more research. Patients would love more research. There's a lot more research to be done, but there is no more need for research for patients to get it. We mean that so much. These patients are desperate. The patients that work with us, Elvie, Irv, George, they go out, and I'm going to back up a little. 2 of the patients that were doing great work that really impacted us when they died, and I hope I can say it and get through it. Barbara and Kenny Jenks, a young couple in Florida. Kenny was a hemophiliac, and he unknowingly, he got contaminated blood products, was HIV positive, didn't know it, unfortunately infected his wife. Both of them became very ill. Poor young white couple, extremely ill, spending their time in bed by the garbage can, throwing up. They was very used to giving, he was very used to giving himself medications, but neither of them had tried cannabis. At an AIDS support group, they found out about that. Barbara was not going to try it. Kenny said, what the heck. He tried some cannabis, and he was able to help his wife the next day. He had breakfast, he ate, he was fine, and what can I do for you, Barbara? How can I help you? They eventually got arrested. They got convicted. The judge was compassionate. He sentenced them to community service to each other because he realized they weren't criminals. Anyway, they joined Bob, and they were working with helping people with AIDS, and that's how that big number of AIDS patients were coming in to get their IND access. He was told at one of the meetings by DEA, young man, you know, I think you better be quiet about this. And there was a threat there, and of course, Kenny's looking and he's going, quiet? I'm dying. What do I have to lose? You're going to take my medicine away? But that was the threat. We'll take your medicine away. And so we do have our heroes here, the patients. And that's why we keep going. Anyway, so in 95, we started Patients Out of Time. By 97, I wanted to put a, well, no, it was many years earlier, I wanted to put a book out, and I was smart enough not to be that marijuana nurse to put a book out. So I can't even remember what the count is. We've got about 16 other authors, contributing authors, that helped with that book. It's in your reference list there. I just put it suggested reading because we tried to cover everything at that time about therapeutic cannabis, moving into actually the health benefits of the seed and the plant and the planet benefits of the hemp products. This is a very beneficial plant that you have all heard lies about over the years, that it's just fine, that when they find a crop, they burn it. And somehow that's a victory. You know, we got 10,000 plants today. We got 750 plants. Oh, the biggest in this county or the biggest in that county. And they're thrilled, and they've burned it, and they've destroyed it. And what are we doing? It's really kind of crazy things going on. I didn't realize it until just this summer when my ex-boss told me when that book came out, the director at the University of Virginia, the medical director, called her into the office to wonder what we had a nurse like this doing at the hospital, writing a book like that. Luckily, my boss was a very enlightened nurse, a very compassionate nurse. She told him she thought he ought to read the book before he said anything else. And that was that. So anyway, I was able to continue working. I worked at the University of Virginia as the addictions consult nurse, and unfortunately there were many times that when I went to see patients, sometimes it was because they used marijuana, and I said, okay, what's your problem with the patient? Well, they use marijuana. Okay, what's the problem with the patient? Whereas, you know, with alcohol, usually it was, well, they've got cirrhosis, they've got a GI bleed. It was, you know, many, many problems. The tobacco smokers, different people with problems. But very often when I did find out someone was using it therapeutically, I was able to talk to the physicians in private about it, and they were supportive. And we discussed with the patient whether they wanted it in the chart or not, and whether we should chart it or not. And so if they did want it, we put it in there just feeling that their record was safe, whereas some patients, unfortunately, the fear was a little too great, and they took it out. So moving on, we decided we needed to do more. The other thing in your packet, what you'll see, is the list of support organizations. And I'm very happy to say we've got a nurse here from the, someone from the staff of the Medical Society of the State of New York, Barbara Ellman, and she brought with me the Medical Society for the State of New York's resolution in support of therapeutic cannabis that just came about. Patricia Malloy from the Rhode Island Nurses Association brought me a local paper the other day that noted that the Rhode Island Medical Society and the Rhode Island Nurses Association just endorsed a position paper. So add that to the list. We'll add that to the list. But one of the reasons Patients Out of Time made that list was when, as Al calls drug czar McCaffrey, Fibber McCaffrey, when he would say that no healthcare professionals support this, it was the intimidation of the government saying that, that just scaring the heck out of healthcare professionals, threatening the loss of their license. So we wanted to have this list there and say, yes, they do. And we thought the organizations, one, it gives you bigger numbers, but it was the safety. And probably the icing on the cake for me was this summer when the American Nurses Association passed its resolution. It's in there. It's in there, and I think they said it all. I mean, they're basically saying they do support research, but they want the patients to get the medicine. They don't want healthcare professionals intimidated if talking about their medication. Get it out of Schedule I, and of course support the education of nurses. So I ask anyone from any specialty organization, whether it be hospice, cancer, rehab, state organization, anything, you can take a model of this and put their name in it and just say, we support therapeutic cannabis. There's no reinventing the wheel that needs to be done. But the longer this list goes, the more difficult it is for George Bush, Ashcroft, Walters, the litany of all the people that we're fighting. They don't have much to fight with if we've got all these organizations behind. So after getting the organizations, then our next thing is, okay, let's get the information out. So this is our third conference. The first one came about because that's one of the reasons why Al and I refer to Melanie Dreyer as our hero. She's on our board of directors. But Melanie got the University of Iowa to say, okay, we'll have the first national clinical conference on cannabis therapeutics in Iowa, in the heartland of America. People wondered, what the heck, why Iowa? But it was Melanie, but it was fitting too. This is about patients. It's about regular people. Get away from the politics of the East Coast. And the West Coast, as great as they are with cannabis, unfortunately, sometimes people think, oh, they're out there. And California sometimes is its own country. So in many ways, Iowa was fitting. From there, in 2002, we went to Portland, Oregon, and the reason for Portland was it was one of the states that had a program going, and we had actually people from the first conference who wanted to have it there. It was a pain clinic that wanted to have our conference there. Planning was going fine. The committee approved it for CME units. And the next thing you know, the hospital administrators cut them at their knees and said, we're not going to have it here. That left us scurrying a little bit for a while. We were going to go to Canada and have it. And then we came back to Oregon when the Oregon Public Health Department basically said, we'll help sponsor it. And the Oregon Nurses Association helped sponsor the conference. So we went back there. And to my delight, I say delight, that's a poor choice of words, but I was very pleased to know that there was a doctor who actually resigned from that hospital out of just indignation that their CME committee decided we needed to have this. They had a big pain clinic. They were seeing a lot of patients for cannabis and pain, and the administration said, no, we can't be a part of this conference. And he literally resigned from the hospital because of that. I'm just doing this to check my time. So anyway, so here we are in Virginia. I tried since I think '95 to get a conference here. I brought it to our people at the continuing education of nurses at UVA, good people, some good friends, and they smiled and said, okay, we'll bring it forward, and brought it to the dean of the College of Nursing. Okay, we'll have to take it forward for approval. And they came back and they said, Marilyn, I'm sorry, it just doesn't meet our needs right now, our educational needs. And so we're a university. Aren't we supposed to educate people about this? And, and that was the answer, and I left. And I don't know, sometime later I thought, well, let me go back. And I went to the director of nursing and I said, why don't we just have a state conference for the nurses? Marilyn, it's still the same political problems. And I said, okay, thank you. I just wanted you to tell me that was the problem, because the State Nurses Association did say, the Virginia Nurses Association passed a resolution back in '95 for this. And, yeah. And it did have the support of the HIV committee, the ethics committee, and all the chapter district presidents of the Virginia Nurses Association before it went to vote from the Virginia nurses, before the Virginia members. But they said they support the education of nurses, and aren't we supposed to do that, educate the nurses in the state? This is what they said they need education on. It still didn't work. But it came around. This is number 3. It's fitting we came here. We were very happy to be here because we were nice and close to D.C. and kind of saying, we're here and we're not going away. I did neglect to tell you that in Oregon, 3 days before the conference, I think Al might have told people in the past, but 3 days before the conference, the drug czar did go to Oregon to tell them that the marijuana people were coming and they ought to watch out. When we were here, UVA from the Continuing Medical Education Office asked us, by the way, Marilyn, we forgot to ask you, do you have a problem with protesters at your conference? I said, well, if you mean the federal government, yes. But no, we've never had any protesters or picketers walking outside against this. You don't understand. The people get it. When I finally got something published in the American Journal of Nursing, that again took years, and it wasn't me. It was somebody else soliciting an article in the substance abuse column. They wanted to ask a question about, what about cancer patients and AIDS patients who use marijuana, and they tell me it's for health. And the nurse just thought that would be a fitting column, Marilyn, why don't you do that? It sat there for 5 years. None of the editors would touch it. And finally, it was a new editor. She said she had published that, and when she did, I was eagerly awaiting the letters. And I called in a couple of months, and she said, yeah, we've gotten some. 4 months later, they finally published them, and it was, I think, 5 letters of support that they picked out of whatever they had. And it was all support. There were no negative letters. So there is this hysteria, and I think the whole thing, it's trying to get people to understand their word lies. We're not teaching them about a drug. It's like we're trying to unteach them what they heard about something. And that's much more difficult. If this were a new drug, it would be available tomorrow. But it's been decades of lies. And people have grown up with them, and even healthcare professionals still do that. People have been kicked out of pain clinics when they've been tested for their narcotic and cannabis came up. And what we learned from Dr. Welch is that's a good thing. That's a smart thing to do. Mix the two and you'll get lower doses. So anyway, the idea is for you to take this information to try to help other people unlearn what they've learned.